concussion is a blow to the head, which causes a transient neurologic dysfunction, which can range from mild headaches to dizziness to imbalance, nausea, vomiting, sleep disturbance, cognitive difficulties, memory impairment.
What physically happens inside the head to your brain?
Well, the head, brain's inside the skull, and the brain is bathed by spinal fluid. So when your head is struck, the brain actually moves inside the spinal fluid and will blow or knock against the skull, the back of the skull or the front of the skull, depending where you're hit.
And is it that impact that causes the problem?
So it's either the direct impact or even the secondary impact. So we call it a coup, which is the direct impact, or contra coup, that you hit your head and then you fall backwards, and it's the back part of your head that's the part that's injury.
Does where your brain is impacted, does that impact directly on the impact of physically on you? In other words, whether you can walk, whether you can talk. You understand what I'm saying?
I understand, and to some degree the answer is yes, and depends on the blow. And if the blow is a direct blow, it's different than being hit from the side. And so a rotational injury sometimes are more difficult to recover from than a direct blow.
Okay, and explain what you mean by a rotational injury.
Say being hit straight on the head, that's a direct injury. Say you're hit to the side and there's a rotation inside the brain, that can cause some more damage to the brain cells, some tearing of neurons, axonal damage to how the neurons connect to each other.
So when we watch two boxers boxing and somebody comes around with a roundhouse and catches somebody in the jaw and it knocks them out, is that what you're talking about, a rotational?
Yes.
So it actually turns the head.
Turns the head, yes.
All right. The athletes that we know that have had these things, the time of recovery ranges crazy from a week to a year. Why is that?
Well, you can see it's the type of injury, the severity of the injury, how long the patient was unresponsive. Did they just see stars? Were they knocked unconscious? So that's important. The second thing is, had they had prior concussions? Patients who've had prior concussions take longer to recover from future concussions.
So the longer you're out, the worse it is?
Yes.
I mean,
In general, yes.
so give me a sense of that. I mean, if you're just, as you said, seeing stars as opposed to later, I mean, how much more recovery are you going to need?
Well, it depends, but it would be more extensive. So physical therapy may be involved in terms of getting balance back, improving dizziness. You have to look at cognitive function, memory impairment, sleep impairment.
I know you were watching the game yesterday. As a fan, there's one reaction. As a doctor, watching it happen is another thing. What was your reaction when you saw Mason Rudolph hit the way he was?
I was afraid. I saw the hit coming, and I said, "This is going to be serious." And when the shot came back to the quarterback on the floor, I was very concerned.
So you saw the then follow up the replays and they
Yes.
showed
Yes.
that
So
helmet.
he was being hit from behind and then hit forward. He really didn't have anywhere to go. He took the direct shot. And I noticed that his head did have a slight turn to it when he was hit, and he went straight down.
Yeah, and out apparently. I mean,
and out. Yes.
yeah, because his fellow players said that there was like nothing there at that
Yeah.
point.
I was glad to see Dr. Maroon come on the field and attend to him.
The idea of returning to the field, what kind of additional risk do they face after they've had something like this happen?
Well, once they fully recover and they return to the game, they're at risk of recurrent concussion. So their risk increases. So one concussion doubles their risk of having a second concussion. So we want all the patients to recover fully before they are cleared to return to the game. But still, there is a slight increased risk.
And as far as full recovery, what is full recovery?
Well, there's criteria. We'll do as people do baseline memory tests, and they'll do memory tests. They'll do vision testing, balance testing, coordination testing. So all return to the baselines, and they all get baseline testing before they start the season.
How long can the physical symptoms last after the impact of a concussion?
Well, physical symptoms can last for weeks. Headaches can last for weeks.
And what are the other physical symptoms?
Well, the dizziness, cognitive, memory loss, sleep disturbance.
And that can be with you for a long time?
That can be with you for a long time, yes.
Ugh. So the idea of a professional athlete bouncing back in a week is kind of a fairy tale.
I think in this case, yes.
Based on, obviously, you haven't examined Mason Rudolph, but your professional opinion was ouch.
Yes, was ouch for, say it likely, yes.